Welcome, everyone. I am Darcy Purcell. I am with Gordon Medical Associates, and I want to welcome Deanna Hansen back to the forum.
Thank you, Darcy. Pleasure to be here.
Yeah, so today, everyone, we are answering the questions that we did not get to during the webinar that Dr. Gordon did with Deanna 2 Fridays ago, and also answering some questions that came in after their chat. So I'm just going to jump in and start asking a few of these questions, and we'll see where things go, Deanna.
Perfect.
So one of the questions that is coming up is different sorts of therapies. So I'm going to ask you about a therapy, and then if you could speak to how it is different or relates to your work, that would be great. So the first one is, what do you think of Rolfing?
I've never actually had a Rolfing session. However, I understand it's very, very deep tissue fascia work, as is ours. However, it comes with a very different component, being that you're receiving it from a practitioner. So with block therapy or fascia decompression that we teach, you're the one doing the work for yourself. So you're able to gauge the pain from a very different place because you're the one in control of it. And you're continually educated about your breath as your guide. So as long as you're breathing in a relaxed way, you are feeding and healing your cells. If it stresses the breath to the point that you're not, then that's your body indicating that it's too deep. So having not personally had a Rolfing session, although having had many people tell me about it, that's sort of the best I can give as far as the differences. But I hope that helps.
Well, also, I'm thinking about the consistency and the cadence of doing block therapy versus someone going in for maybe a monthly Rolfing session, right?
Yes, really, fascia decompression is all about learning proper habits. And thank you. That's great feedback, Darcy, because that's really the basis of this work. It's to teach not only the releasing of the adhesions, but to also strengthen proper diaphragmatic breathing, as well as strengthening proper postural foundations. And it is the daily work that really gives you the most value, because we are changing the habits of what we have been unconsciously doing for our lifetime and bringing consciousness into our movements and our breathing, which does, at least initially, really take that daily application to integrate properly.
And the next question is, does massaging the lymphatics help the fascia? So really, lymphatic massage, what is that doing in terms of supporting our fascia?
Well, I think at the end of the day, all efforts with any kind of body work is to improve flow within the body. The challenge with the lighter touch work is the adhesions develop through the layers of fascia and grip onto bone. And that's really where the root of the issues are, because these adhesions lock us in these negative alignments and create these beaver dams or blockages to blood and oxygen flow, as well as to being able to clean the cells effectively. So that light touch will give flow through some of the layers, but we need to get to the root of the issue to actually create a transformative change in the body, with the goal of pulling those cells back to proper alignment.
So lymphatic massage, very different than this deep fascia decompression work.
Very different, but would be totally complementary.
Great. Myofascial release massages, dry needling cupping. We got a lot in one question there.
Yeah. Again, all with the same intention. And I believe really it's always with the intention of improving blood and oxygen flow to cells. It's more a question of the depth that we're going to, as opposed to the area that we're working on. So I think I even used the analogy on the call where the difference between taking a boat on the ocean and deep sea diving. Some of those other techniques are going to be more surface. Anytime you're rolling or addressing the surface of the body in any kind of stroking manner, that's not going to allow us to move through the layers of adhesion to get to the root at the bone. So whether it's cupping or anything like that, it's all designed to improve circulation, but without the integration of all three pillars, which I truly see are integral in creating that cellular shift and change, then the benefits will be, they'll be there, but they'll be more superficial.
Okay. We're gonna go all over the place now. So the next question is there a connection between fascia restriction and sleep apnea?
Yes. In fact, it was so lovely. Years ago, one of our members in our community group, after doing block therapy for 3 months, shared that she got off her CPAP machine because really it comes down to the alignment of the whole body. When that rib cage is pulled forward and down, and that's manipulating the alignment of the shoulders and the head, that's what's creating so much congestion in the front of the body. So we're not able to go into that relax and fully breathe properly and get oxygen to the brain when we're sleeping. So this work changes the entire structure of your alignment so that we can release those adhesions and get back to being able to breathe in a relaxed way. Because if you think about a straw, as soon as you compress and you twist it, now you have to, you know, force the breath to try to even get a breath. And that's kind of what's happening when we're in this forward alignment, and we're literally magnetically sealed that way. Even when we're lying on our back, we're still held with those adhesions in place. And that's twisting the passages for all flow within the body and really limiting that. So then the body has to work that much harder just to try, or the heart does, just to try to even send blood and oxygen to the cells and also to detoxify the body. So this is a wonderful process because we not only get to where the issue is, we get to the cause sites, which are literally riddled throughout the entire body when we're dealing with this kind of work.
Can you speak a little bit? I'm going off script here. Can you speak a little bit to that? A little bit. I think what you talk about, the cause site, pain site. Like, so say you're having sleep issues in general. What could not so far maybe as sleep apnea, but just even like sleep issues in general? What can people think about being the cause of that?
So we need to have oxygen in the brain to actually go into those restful phases of sleep. So as soon as we have any kind of forward head tilt and we're blocking those main arteries supplying the head, now we are limiting the amount of blood and oxygen flow to the brain. And that is going to be driven from, even let's just look at the arms, for example. Anatomical position is palms facing forward. But if you look at pretty much anybody standing, their palms are going to be facing the back of the body. And that's an indicator that the rib cage has collapsed, which is causing the arms to be internally rotated. And that's pulling everything forward and then blocking the flow through here. But that's all even driven by what's going on in the legs and the feet, because the fascia will grip and adhere to bone with an incredible 2,000 pound per square inch force. And the further that the tissue is from the diaphragm, which is the furnace, the more strongly we are held out of alignment. So the calves and the feet, the forearms and the hands, they're the furthest from that engine. So even if I spent months working on my head and my neck to attempt to improve alignment, every time I stand up and I start walking, I'm going to get pulled into that negative fascia pattern that exists in the limbs. So that's why we really need to take a look at the full body and understand what we need to release, where those anchors are, so that we can improve that flow full body.
When I think about it, I think about ankle twists when you were a child that you had no idea might be affecting, you know, your health now. Like, it's fascinating to me. So your work and block therapy addresses the entire body, from feet to hands to head to everything.
Yes. And, you know, great question. If I can just dive in there a moment. So when we have something like a sprained ankle, if we have addressed that with the traditional approach, rest, ice, compression, elevation, maybe you've been walking on crutches, and this is years ago, we healed with scar tissue as opposed to rebuilding that tissue in the way that it was prior to that injury. With the approach of fascia decompression, we actually teach you how to treat acute injury in a different manner, where we're not limiting inflammation in the moment, we're actually supporting it. And the difference is a rebuilding of the tissue instead of that gap that was created from an injury being filled in with just the netting or the scar tissue. That actually changes your entire body's alignment. And then you age from there going forward, and you start, so that does become like a real cause site for issues down the road. So when we can approach acute injury with a conscious intention to support inflammation through proper breath and keeping channels open and conscious movement, then again, we can rebuild that tissue as opposed to allowing scar tissue to take over.
The next one is a woman asked, I have a son with severe pain abdominally for years. How can you support his healing?
The first thing that we would need to look at is the breath. So whenever we're dealing with anything in the abdomen, we're going to be having a diaphragm muscle that's weak. And what that does, as the diaphragm is the foundation of the rib cage and everything above, if we aren't conscious breathers, and unless we're trained to be, we're not, then everything from the rib cage up falls into that abdominal space, displacing the organs, causing a sluggish system. So we don't absorb optimally, we don't eliminate well, we get a backup of waste in the gut, we get inflammation, and then that attracts other things to go on there. So that would be the very first thing. But again, I would still address the full body, because what's going on in the limbs, the legs in particular, are also going to be impacting that abdominal space. When the feet aren't positioned properly under the body, that impacts the alignment of the hip joints. So you've got the hips that are squeezing the space, you've got the upper body that's squeezing the space, and what that results in is a ton of internal tension in the gut. And if we don't have the space again for optimal absorption and removal of waste, then we're going to have inflammation and pain, and that's going to lead to other things down the road. So I would address first in the way that we do with fascia decompression, through teaching him how to breathe and creating some release of that tension in the abdomen.
And chronic gut conditions are so prevalent these days that I'm hoping people are hearing what you just said about the hips and the hands and feet and the posture, and that it may not be about your probiotic. It could be about your posture.
Right, because the thing about adhesion and scar tissue, you can put the most wonderful medicines and foods into your body, but if we have these barricades or these beaver dams in the way, then the cells can't receive the nutrition that they're craving. So addressing the adhesion, in my view, is the most important thing that we need to do, because people talk so much about the negative aspect of inflammation, but the inflammation is there because of adhesion and scar tissue. It's there because the body's saying these cells aren't getting what they need, so we're going to keep sending more and more and more. However, if we don't know how to keep the flow going in the tissue itself, then we get a backup, and then it becomes chronic and stagnant, and it can become damaging to other cells. However, even in that chronic stagnant inflammation is all of this potential for healing. We just have to heat it up. And we do that through turning on proper diaphragmatic breathing. That's like turning on the body's internal furnace.
And proper diaphragmatic breathing, for everyone that's listening and doesn't know what that is, like I didn't know originally, what can you share a little bit more about what that looks like?
Yes, absolutely. So at the base of the rib cage is the diaphragm muscle. It's a plate of muscle that moves up and down in the body when we're using it properly. When we inhale, it moves down into the abdominal cavity. When we exhale, it lifts up. And if working properly, it's this pump that's working continually in this area. So the abdominal organs, the heart and the lungs, they're getting a massaging all the time, which creates heat and flow. The challenge is pain, fear, and stress cause us to reactively hold the breath. So we're designed to survive. So if we're not breathing diaphragmatically, we're still going to be breathing, but we're going to use those secondary muscles of the upper chest to do the work for us. Unfortunately, these are weak muscles in comparison, and they don't draw the air deeply enough into the lungs to reach where the majority of the oxygen receptor sites reside. So we have way less oxygen absorption in the body when we breathe from the muscles of the upper chest. And oxygen is the nutrient that the cells first and foremost require to function well. Also, when we're exhaling properly, we are moving the most waste out of the body, as opposed to using the muscles of the upper chest, which again are just very limiting in their ability to keep the body functioning as it should.
I think that's fascinating. So the next question, we're going to move to the mouth. So in terms, is there a connection between the tongue, facial tension, fascia, and neurological issues?
Great question. And yes, first of all, there's a connection between everything. Fascia is the tissue that innervates every single cell in the body, like skin to the body. Fascia is the skin to the cell. So when the tongue muscle isn't properly aligned, it is typically forward and moving over to one side or the other, depending on your specific alignment. When it's correctly aligned, it actually supports the weight of the head in correct position. So you'll see people that have their rib cage pulled forward or compressed, and that's going to be pulling the head forward. That, first of all, is going to be a major barricade to that blood and oxygen flow to the brain. All of the communication between the brain, the gut, like the nerves even are made of fascia. The fascia innervates everything. So when there's adhesions in an area, it's basically these disconnects through whatever cells aren't connected. So the tongue is highly important because when it is aligned, again, we're keeping the flow for everything in the head optimal, as well as that connection from the heart to the brain optimal, everything. So I don't feel like I answered that question very well, but maybe you can throw something in there to make sense of this.
No. It definitely makes sense. And Nafisa speaks quite often, Dr. Parpia, about the sinuses and our neurological health. Can you speak a little bit to the sinuses and fascia?
Yeah. So when you look at somebody that's, say, 20 years old, and you look at the shape of their skull, probably at their age, they're going to have, a fairly symmetrical head, and there's going to be optimal space for their brain and for everything in this space. What happens as we age is we compress, but we literally wind down in one direction or the other. So if this is my head, I'm going to either wind down this way and there's a squeezing effect, or this way and there's a squeezing effect. And if you look at a comparison between a person who is younger and then, say, decades older, you can really see a difference in the change of shape of the skull. Basically, it gets squished. So it becomes more narrow and longer. So now if you think about the palate, the roof of the mouth, when the tongue is in correct alignment, you'll notice about a pinky nail distance from the teeth, there's a ridge. The tongue naturally docks into that ridge, and the surface of the tongue should be there to support the roof of the mouth. And if everything is in proper alignment, then that support creates optimal space in here for breath. Now imagine you've taken this globe and you've twisted and squished it. So now the roof of the mouth becomes narrow and twisted, and then that's going to directly impact the sinuses and then everything else up the chain. So this work actually very beautifully restructures the shape of the head, as well as all of this stuff to support that optimal flow.
I will say, just as a side note, I've been using the new paddle for the face, and it is remarkable when you're doing that sinus work. Well, all of the work. I had no idea. So personally, unsolicited, I am saying amen as you're speaking to all of that. There is a question here about a woman who says, who's asking about fascia as someone gets older, and why does she wake up feeling so stiff? And the first hour, even just coughing can cause her back to tweak. And just everything is a slow process until things, quote, loosen up. What are your
So
thoughts on
it's really
this?
things heating up, because when we are a correct temperature, we have optimal flow. And what happens as we get older is gravity is constantly compressing us. So what we lose with time is internal space. And as we lose that internal space, as we become shorter and wider, basically, then the fascia, designed in part to keep us upright, like a spider spinning its web, it shoots out adhesions to create stability. So if I'm always, we're dominant on one side. So if I'm always using my right hand and tipping over to the left, eventually, if my fascia wasn't here to look after me, I'd fall. So as time goes on, we end up compressing on one side because that's our nature. And then adhesions develop to create stability. But the compression is dense tissue, and gravity loves density. So the denser we become in certain areas, the faster gravity is going to be pulling us down and manipulating us. And the more adhesions we have, the less flow we have, the less breath we have through the diaphragm. So we're breathing through these muscles of the upper chest. And I always use the analogy, the diaphragm is like the body's furnace. The upper chest muscles are like having a space heater. I live in a 30-story building, and even in my 2-room apartment, if it's -30 outside and I only have one space heater, I'm only going to heat one room. If I turn the building's furnace on, the entire building of 30 stories will be heated. So when we're looking at what's causing stiffness, it's really cold tissue. I live in Winnipeg, so when it's -30 in Winnipeg, you can't just go out and turn your car on and drive it. It needs time to warm up. So when we've been sleeping and we don't have that movement in the body, if we don't have a strong breath, we're going to wake up and we're going to feel that stiffness because those adhesions are blocking flow. We haven't been breathing well. So we have all these areas of stagnancy, pooling, and we got to get that inflammation moving before we can feel like, okay, we don't have things impeding our movement within.
So if you start using this practice and you're learning to do more bring more diaphragmatic breathing into your day, chances are you'll be less stiff in the morning because you will have got the oxygen is flowing.
Yes, because you're melting through those adhesions that are causing the issue in the first place. You're getting rid of the things that we don't want to have in the body.
Yeah. Okay, that's great. I don't know if we answered this originally, but I'm going to ask it again. We're going to go back to the upper body here. My daughter has tremendous amounts of pain in her neck and shoulders. I think we did, along with headaches, but it's worth bringing it up here again. I'm curious if it's her odd habit of chewing the inside of her cheek.
Oh, well, the thing is, if she's chewing inside of her cheek, it's likely because of the way that the jaw is aligned. So the cheek is probably getting in the way. If there was proper space, that might not be something that she's doing. But yes, anytime we're doing something on one side more than the other, even how we chew our food, that over time is going to create a migration of the alignment. And again, if I'm always chewing on one side and I'm compressing, wherever we have compression on the equal and opposite side, we have ballooning. So we have all this tissue that gets, there's only so much tissue. So if I had a towel here and I started to twist it, the entire towel is going to get pulled into that system. And then the towel over here is going to be stretched out. So where there's ballooning, there's less cells to work on our behalf, yet they're the ones being forced to do all the work because all this other tissue has gotten caught in the mix of the compression. So we've become out of balance. So we want to release where we're compressed, pull that tissue back so that we can bring balance and symmetry back into the body. And if that's the case, then again, the cells receive optimal flow throughout.
I'm making notes. This is all great. All right. The next question. Do you have any advice on plantar fasciitis?
Yes.
I think you have a lot to say about plantar fasciitis.
I sure do. So whenever I'm looking at bodies, I always look at what's going on in the ankles because the goal is that we have a neutral ankle. There's a saying, death starts in the feet. So when we have issues in the feet, we really want to pay attention to that because as soon as we start compensating, you're going to be impacted all the way up the chain. So with plantar fasciitis, often you're going to see a pronation occurring, which is going to put excessive stress on that plantar fascia, which is going to cause tearing at the heel and potentially a bone spur, which can be very, very painful. So we want to change that dynamic by bringing those ankles into neutral and bringing strength into the feet. So we're not allowing one feet to basically act like a flat tire. That flat tire pulls the body away, causing the other side to anchor. And then that causes, again, tension and torsion up the chain. So the body is in this war. So with plantar fasciitis specifically, we want to really address the whole lower body. I have a 21-day pelvis, legs, and feet program that addresses you from the feet all the way up to the pelvis because everything is interconnected. So we want to release the pattern of fascia that we're currently in through the process of the fascia decompression, but then rebuild correct alignment. And that's not a one-time thing. That's something that happens through a process of release, rebuild, release, rebuild. So these programs are designed to really beautifully take you through that to be really effective and efficient. But one simple thing that you can do if you have plantar fasciitis is, roll up a towel, or if you have a wooden rolling pin, you can even stand on it for up to 3 minutes as your breath allows. And then when you're standing, grip the toes. Have your feet pointing. In fact, do this in front of the mirror, because you want to be in correct alignment, but stand in front of the mirror with your feet right under your body, bend the knees slightly, and then grip the toes and see if you can hold that grip for up to 10 breaths. And then do that throughout the day. As you're gripping, you're going to be supporting the strength in the feet so that that plantar fascia is positioned where it should be and it's doing its job, as opposed to the foot collapsing. And then you have all of this tension causing the tearing away at the heel.
I love it. Okay. Let's talk a little bit about chronic illness in general, because this audience is struggling with mold, mycotoxins, Lyme, mast cell, you name it, long haul. How is it that this work can complement their healing, no matter what they're struggling with?
So I love using the word dis-ease instead of disease, because in my view, disease is limiting, where dis-ease indicates an imbalance of ease, which we can bring back into the body. And ease of the body is regulated through the breath. So when we have cells out of alignment, the first thing we need to understand is, and we all do. So the first thing we need to understand is, as our body is pulled out of alignment, that's impacting our breath. And if we have an impaired breath, we have cells that are starving, and we have areas that have become toxic. So that's really the basis of all dis-ease in the body, is what's going on with the breath. Because if we're not breathing properly, then we have stagnancy, we have starvation, and we have imbalance. So whether it's not simple, but whether it's just like a chronic pain in the back, or whether it's Ehlers-Danlos syndrome, or some other like rheumatoid arthritis, or whatever the name of your situation may be, when we don't have a breath that's regulating what gets pulled in and what gets released, then we pull things in and they get stuck and stagnant, and we don't release them. And then that becomes a toxic problem. And then that toxic area, that acidic area, attracts other things that live inside of us that also create waste and more problems, and we become inflamed. So if that has gone on for years or even decades, it can be very hard to really understand your own body, because you'll have so many issues in your body, and you only have so much energy to fight and to, reestablish a healthy body for yourself. So starting with the breath, to understand the detoxification effects through proper exhalation, and also starting to properly feed the body, is the first step. So no matter what, we want to understand the value of moving the waste out of the body to clear the way, so that we can bring that balance and that health back in. And it's a journey and a process, and every part of the body is interconnected. So we can't just start here, which is again why we create our programs, to cover the full body in a very systematic way, so that we can step after step move the toxins out, bring the good in, move the past out, bring the present in. And that's the key. It's really this buildup of the past and all the stuff we've absorbed, including energy, like in negative relationships, because again, pain, fear, and stress cause us to reactively hold the breath. And if that breath isn't working from relationships that are harmful or toxic, or from simply eating negative food or being in a toxic environment, basically the fascia is absorbing it all, and all of it impacts how we breathe. So we can undo that through this process.
Yeah, and I know Eric really loves your program, so I want to talk about that a little bit after one more question.
Sure.
And then I do want to speak to the program itself. So when we're talking about earlier, we were talking about accidents, broken bone, ankle, and the different perspective on how to heal. And we touched on this briefly during the original live webinar, but people that have surgeries, could you speak to that again? Because there were so many questions about surgeries, and post-surgery protocol versus I had a surgery so many years ago and I'm still feeling like there are adhesions in and around the area. What would you say to both of those?
So with regard to surgeries from years or decades ago, the surgery itself, of course, is going to create scar tissue. And then from there, it's going to continue to increase because scar tissue is like a gravity where more and more and more gets pulled in because again, gravity loves that dense tissue. So if I have let's say I had a C-section, for example, and the scar goes from, one hip bone to another as I move or I have lack of movement in my body over my lifetime and I'm dominant on one side, that scar tissue starts twisting and sticking onto the bone and manipulating the organs inside. And then it continues to grow. So that's a very real thing. We can really feel those adhesions adding up over time and becoming more problematic because not only does it add bulk, but it also traps things inside of it, which can become things like cysts and whatever else in that space. So diving into the body, it's beautiful because we have so many people in our community that have used this to help melt through scar tissue, especially in that area of the lower abdomen, because you can really get a sense that you've lost that connection to those abdominal muscles. And then you get this pouch and it's frustrating because it can be very painful as well. So to get in there and to spend time melting through the scar tissue is what this work does. When we understand that scar tissue, whether it's scar tissue from injury or surgery, or adhesions developing from unconscious posture and lack of proper breath over years, basically the adhesions in the scar tissue act the same. They're the barricades to blood flow. They're dense areas. They create colder areas in the tissue, and then they create cells that aren't getting properly fed or clean. So at any time, you can dive into this work when you've had a surgery from years ago. With regard to surgeries more recent, this is a really exciting time actually, because you have this opportunity. It's really interesting when we have an injury. And again, you can consider a surgery an injury because you're literally cutting through tissue, right? So either way, when you have something happen to the body is in this state of, I need to heal and repair. So you have a body that's already primed for healing, but we need to use that inflammation that is being sent in the moment to assist that process of healing. And that's where the whole concept of rest, ice, compression, elevation doesn't make sense, because we want to support that energy. We don't want to stop it. So we're very cautious with how we direct people after a surgery to begin this process. But first and foremost, start breathing, start understanding that proper diaphragmatic breathing, because when you turn on your own body's diaphragmatic breath, you become a more efficient healer. Oxygen is the first nutrient that cells need to heal. And also we want to pull the debris away from the surgery so that we can create that space for the healing to happen right away. And then we can start gently with our hands. The body loves pressure. Pressure is like a hug. Like when we're sad and we're scared, you give somebody a hug, it's very soothing. So when we're doing this work and we're putting pressure into the tissue in a very conscious, slow way, like we teach you, whether on the block or using your hands, then you are supporting the process of healing through that addition of pressure. And pressure also soothes pain because the pressure fibers are larger in diameter than the pain fibers. So if you go and you bang something, that impulse is to rub it, but pressure actually is really where you're going to get that benefit. And then just the pressure alone is going to send more blood and oxygen into that space. And it's nice because depending where the surgery is and what's happened, you can also support the body from a distance. So it's one thing if it's in the abdominal area. It's another thing if you've just had, a fracture in your foot, or you've had a surgery in your knee or a knee replacement. You can do a ton of work in through the core to keep that breath strong and down toward that site of surgery or injury, whatever it is, to support the most efficient healing process. But that's where our community group is really important, and the connection to myself through this program. We're always here to guide people, because you can't just give a recipe for everybody, because people are unique and different in what their needs are. But there is also a generalization that we can apply to this work that is applicable.
Yeah. This has been so great, and we got through the majority of the questions. Good for us. And so I would like you to share a little bit after I share something. I'd like you to share a little bit more about where people can learn more about you. Before you say anything, I want to share with everyone that there is a 9-part series that Deanna has generously offered to the community at no charge, which gets people started using a rolled up towel, and you will be amazed at what will start to happen with just a towel. We do love her block. And so I want you to share a little bit about your block, but I want people to know that you can walk away from this and you have access to a tool to begin right now. Like, you can stop the video and go download it and start immediately. So Deanna, share a little bit more about block therapy.
Yes. So all of that information that you can access right away is really foundational in understanding how to decompress your fascia. It's all about going nice and slow. So we take a minimum of 3 minutes in each position because we are here to melt adhesion. So if we're rubbing on the surface, again, if you're taking a tool and you're going on the surface, you're going to be affecting those surface adhesions. But what we really want to and need to address are the roots at the bone. So like deep sea diving with this process, we teach you using, here's a block buddy right now. So there's 2 different sizes. I don't actually happen to have the little one with me, but we've
There's
got
a
2
smaller
different
one.
sizes. There's a smaller one, yeah. And so we teach you how to lie on this throughout your entire body. And through the process of lying on it, first of all, especially when people have things like fibromyalgia or they're really pain sensitive, they think, oh my gosh, there's no way I'm going to lie on something that's hard. This is made of bamboo. We use bamboo or wood. And it's not
Wait,
solid,
or
but
what kind of wood? You said bamboo or wood.
or wood. So we've used cedar,
Aha, got it.
also elm will be in the future for our new ones. But the reason we use this medium is because they are similar in density to bone. So if we use something that's porous and we're trying to get through those layers, we're not going to be very successful because we'll get stuck at those top layers. So that's why we use the tool this way. Also, the surface area is important. When we're in a position and we're lying there for a period of time, the surface area creates a comfort. And again, those pressure fibers override the pain fibers. So as soon as you're in position, we instruct you on proper diaphragmatic breathing and we teach you how to access it. And we have, basically, there's only 2 rules in block therapy. One of those 2 rules is your breath is your guide. So you're the one that is administering this work into your body. You're fully in control. There's nobody doing this to you. So you can decide through your breath, which we continually prompt you, as long as you're breathing in a relaxed way, you're feeding and healing your cells. If anything hurts so much, it takes that relaxed breath away. That's your body saying that's too intense. And then if you're starting on a floor, you can go to a bed. A bed will be a lot softer. We also have approaches on a chair or with a towel. So you can start with that towel right away. And then if you like that, this will be a natural next step, and it's going to provide you so much more than just the towel will. But it's also the way that we instruct you to move when you're on the block. We're not moving fast ever. It's all very slow and controlled. And we're teaching you to move through the layers of fascia. So we don't ever slide on it. We teach you how to twist and turn slowly. Energy moves in waves and spirals. So does how the body ages. We wind down over time. So when we can tap in to this twisting action, we can shear apart those adhesions, even that scar tissue that's basically a magnetic seal, open up that space. Then as you're instructed on the breath, we pump that blood and oxygen flow into that space, that beautiful oxygen. Those cells take it right away. They become nice and buoyant and they lift. And then we get to that next layer of adhesion, which again, now we'll search for more pain. So we teach you to become pain seekers, because when you move into the pain, pain is no longer the bully. It actually is a friend. It's really just the baby crying. And it's your cell giving you information that it needs a little bit of time and attention, but we've been conditioned to ignore that pain. So we teach you how to move through those layers, tap into that pain, use that pain as your navigator, and then you melt through those adhesions. The pain goes away, then you find that deeper pain. So it's incredibly empowering. But what's beautiful is when you're up out of position, that increased range of motion from that releasing of those adhesions and that increased blood flow feels just heavenly. And so I hope I explained that well. Did I miss anything?
Yeah, no, that's terrific. And it's blocktherapy.com for those that would like to check it out. We'll also have links, as I said earlier, to the free 9-part series. And also, if you're like, I want some blocks now, we will also have a link so that you can learn more and purchase blocks if that feels right for you.
Wonderful.
Yeah. So thank you, Deanna. Really appreciate it.
Thank you so much, Darcy.